Hello, everyone. My name is Stephanie Sutherland. I'm with Relief.News, and today we're going to be talking about diet and inflammation and chronic pain. My guests today are Johnny Figueroa, who's an assistant professor at Loma Linda University in Southern California, and also Robert Sorge, who's an assistant professor at the University of Alabama at Birmingham. Thank you both for joining me today.
Thank you, Stephanie.
Great. So what we're going to talk about today is how can diet possibly influence chronic pain, and can our diet in fact be used as a complementary treatment or as part of a chronic pain treatment plan. So I recently, last month in May, attended the annual meeting of the American Pain Society, where Dr. Sorge and Dr. Figueroa presented their research in a session of research presentations called Molecules to Man, Diet as Treatment for Chronic Pain, which, Rob, you organized. So I'd like you to start out just by introducing us a little bit to the field of studying diet and chronic pain. How is that kind of branch of pain research developed? Are there many people looking at it, and what's the link? Maybe you can tell us a little bit about how diet influences inflammation and why that's important for pain.
All right, sure. So in terms of it being a new area, it's certainly not a new area. People have been looking at this for years. In fact, there's been clinical trials since the 80s looking at ketogenic diets and Mediterranean diets, changing pain sensitivity in humans. But those sort of things don't get a whole lot of press because, of course, as you know, there are new fad diets that come out just about every week, and so
Right.
they tend to sort of get lost in the shuffle. In terms of preclinical stuff, Susan Massino and Dave Ruskin at Trinity College, they've been looking at ketogenic diets for neuropathic pain for about 10 years. So it's not new, but it's certainly not a big thing. In terms of inflammation, we know that a lot of the foods that we eat cause a sort of inflammatory response. Carbohydrates, saturated fats, omega-6 polyunsaturated fatty acids that Johnny, I'm sure, is going to talk more about. All of these things trigger the sort of inflammatory response and lead to inflammation. And so in terms of people looking at immunity and immunology, people have been looking at diets for a long time, but has that transferred into pain? Not so much. So that's really what I was hoping to do, is sort of bring a spotlight into this sort of new realm of treatments for pain.
Great. Thank you. Okay, so Johnny, now I'd like you to, as Rob mentioned, maybe you could talk a little bit more specifically. And I know Rob mentioned carbohydrates as one of the potentially inflammatory things in our standard American diet, as we'll talk about.
Right.
But also saturated fats. So can you kind of just give us the lay of the land when it comes to saturated fats? What are they? What do they do in our body, and why do we need them, and where do we get them?
Okay. So from a chemical standpoint, talking about the biochemistry of saturated fats, although they are required, for our proper metabolism, they are fatty acids that have a lot of hydrogen and carbons usually. And what happens with these fats is that when they're metabolized, they produce a lot of bioactive lipids and fatty acids that are pro-inflammatory. So that's one of the major consequences of consuming these saturated fats. In terms of what foods or food groups contain these saturated fats, they are very rich in beef, butter, cheese. So these saturated fats, again, contain a lot of hydrogens, and this saturation contributes to that pro-inflammatory environment.
Okay, so all that delicious stuff that we're not really supposed to eat, like red meat, butter, fried foods. Okay, what about unsaturated fats?
So unsaturated fats, in this case, and there have been a lot of studies showing that these unsaturated fats can contribute to an anti-inflammatory. We have different types. We have the omega-3s, and I know that a lot of people have heard about omega-3 fatty acids, and we also have the omega-6 fatty acids. Again, both of them are really critical and important for not only brain development, but also for brain function. But it's the ratio of those fatty acids that can create havoc in terms of inflammation. So if you have a lot of these omega-6 fatty acids that, again, are contained in meats, in fried foods, soybean oil is rich in these omega-6 fatty acids, then you will have a more pro-inflammatory environment. Versus consuming omega-3 fatty acids that are polyunsaturated fatty acids that contribute to brain stability, brain metabolism, and proper development, and those are contained more in fish oils, walnuts, and other seeds.
Okay, so omega-6 and omega-3 are both unsaturated fats, but really omega-3 is the one that we're aiming for, and
right.
Too much omega-6 can tip the balance towards inflammation, where we want to keep the balance more tipped towards omega-3, which is rich in fish and fish oils and nuts and things like that, right?
That's right, yeah.
Great.
Yeah.
Okay, well, let's talk about the research that you presented at the American Pain Society meeting. First, let's start with some of the research that you've done over the last few years, which you started out doing as a postdoctoral fellow with Marino de Leon. Maybe you could tell us about that, what you found investigating the effects of diet and how we can protect against pain in animals, in rodents, who have had an experimental spinal cord injury, which is a model for spinal cord injury pain in humans, right? Maybe you could tell us a little bit about that.
Right. So in one of the original investigations that we decided to undertake, we fed rats for their adolescence period with different diets. Our idea was that if you consume a healthy diet and you have an injury that creates pain or pain-like behavior in rats, the idea was that we will see some sort of protection in the rats that were fed a healthy diet. Okay?
Mm-hmm.
So we did that experiment. We fed the animals during their adolescence with this healthy diet and not so healthy diet, and we performed experimental spinal cord injury on them. Mm-hmm. And then we evaluated their recovery and also their pain-like behaviors. And what we found, which was really surprising, is that the rats that were in the healthier diet, they didn't only recover faster, but they didn't show strong signs of pain-like behaviors in rats, as we evaluate here in the lab. So those were the original investigations that led our group to actually investigate what are specifically the mechanisms and the bioactive lipids coming from these omega-3 fatty acids that can confer some protection and anti-inflammatory properties. And we recently published a study showing that these metabolites that come from these omega-3 fatty acids can have a very, very robust effect in terms of protecting from pain.
Okay. And so, again, when you said they had a healthier diet, you were supplementing with omega-3 fatty acid, is that right? So they had some fish oil or something like we would take a supplement ourselves?
So in our study, we were using different ratios of omega-3 to omega-6 fatty acids. The control diet basically was 7.5 omega-6 versus 1 omega-3. That's the ratio or the proportion. We had omega-6 to omega-3. In the experimental diet, which was the omega-3 fatty acids, we had a ratio almost 3.75 or 4 molecules of omega-3 fatty acids versus 1 of omega-6. So the differences in those ratios is what we think is actually contributing to this pro-inflammatory environment after an injury.
Okay, great. So again, it's that balance of omega-3 and omega-6.
That's right. Yeah.
Great. So Dr. Figueroa was looking at supplementing the diet with that beneficial fatty acid, but what about the harmful effects of the diet that we are typically eating every day as Americans? I mean, some of us are more healthy than others, but let's face it, we're eating saturated fats and we're eating a lot of carbohydrates. And in fact, carbohydrates, Dr. Sorge believes, is along with the saturated fats, the carbohydrates are a big problem in our diet, and he's looked at feeding animals a diet that's more typical of the American unhealthy diet. So maybe you could tell us, Rob, a little bit about that and what you found when you fed animals that SAD, standard American diet.
Right. so we were concerned that a lot of the work that was being done looking at these sort of bad diets were really just high-fat diets. And we've been told for years, that everything we eat is supposed to be low-fat, and we're supposed to get lots of breads and cereals, and, as we know now, that may not necessarily be the best thing for our health, because, when you have carbohydrates, you get the spike in insulin, and that sort of repeated spikes in insulin and all this sugar in our diet, leads to things like metabolic disease and type 2 diabetes, and it also triggers an immune response, and that immune response can lead to inflammation. And so if we look sort of, as sort of a correlational look at things, if you look over years, Americans have been following that sort of food pyramid where you increase your breads and cereals, and we've also seen a dramatic increase in obesity and type 2 diabetes that sort of track right onto that. And so we were concerned that, some of these diets that were primarily just high fat might not actually be what Americans are eating. And so we created a diet that is almost equivalent or almost exact on the nutritional values that Americans are getting. And so we focused on things like carbohydrates from white flour and sugar. We increased the omega-6 fatty acid levels to sort of a human-relevant level, and we added trans fats also at sort of the human-relevant level. And so we thought this is probably more typical of an American diet than these high fats.
So all that, again, delicious junk food that we're eating.
Yes, all the good things aren't good for you. So when we fed this to animals, basically the animals got fat. And it's not necessarily that they gain more weight. And that was the interesting thing. Some of these animals really didn't gain any more weight than the controls, but when we looked and we imaged their bodies, more of their body was fat. And so it had changed the makeup of their bodies. So more of their body was actually fat tissue, and so they were actually very unhealthy and had this sort of pro-inflammatory state, even though they really didn't look any bigger than any of the other animals.
Interesting. So let's touch on that for a minute. You said that one of the things with the repeated insulin, which comes from eating sugar and white flour in particular, is that it causes kind of an immune response. And you've been talking about inflammation, and now you're talking about more fat tissue in the body. Can you talk a little bit about kind of the link between, I know that fat cells themselves can release signaling molecules. Talk a little bit more about what does that mean when it's pro-inflammatory inflammation at the cellular level, and how does that influence pain?
Sure. So generally, when we think of pain and we think of inflammation, this is due to immune cells releasing signals, cytokines, that are triggering and sensitizing nerve cells and signaling a greater pain response. So when we have an increase in adipose tissue or fat tissue, these cells do release chemicals like leptin, which is a satiety signal, but leptin also causes an immune response and activates these immune cells, gets them working, and releasing these pro-inflammatory or increasing pain signals. When we have an increase in fat tissue, that fat tissue also recruits T cells and macrophages into that tissue, activates those cells, and again, you get this cycle of this increasing immune activation. And so when we look at our animals or individuals in the population in general, obese individuals, in the absence of any pain, tend to have higher levels of these circulating cytokines, so things like interleukin-6 and IL-1 beta, TNF-alpha. They tend to just be in this sort of low-grade inflammatory state. And so we think it's that state which is leading to these sort of health conditions that are coming later.
Interesting. So
if I might add, Stephanie.
Oh, sorry. Go ahead, Johnny.
No, if I might add, in terms of the molecular mechanisms, like Dr. Storch mentioned, once those cytokines are released into the bloodstream and get to either spinal cord or supraspinal levels in the brain or even peripheral nerves, those cytokines hyperactivate neurons that are implicated in the pain pathways. So that's one of the mechanisms, and at least our studies show that depending on the type of diet that you're providing, you will see more or less activation of those neurons that transmit that pain signal. So that's one of the potential mechanisms that that might lead to this nociception and pain in our model.
Wow. So the diet is really having a pretty profound effect specifically on all those cells that are important for pain transmission and pain sensation.
Yes.
Right.
Great. So, Rob, maybe go back then and tell us a little bit, what did you find when you fed rats the standard American diet that you created?
Well, like I said, they had a lot more body fat. We saw a dramatic increase in sort of systemic inflammation, so these cytokines in the blood. So they're in this sort of low-grade inflammatory state. And when we looked in their spinal cords, just as Johnny was saying, we see an increase we were looking at immune cells, and there was almost a doubling or tripling of the number of immune cells that are activated in their spinal cord. And as Johnny said, the more of these cells that are there, the more they're going to influence the activity of those neurons and give this sort of hypersensitive pain signal.
Mm-hmm.
Yeah.
Interesting. And then the rats, after they had an injury, rats fed that diet took longer to recover, didn't they?
Yes, they did.
Yeah.
So we've shown the same sort of thing in mice as well, that it basically is doubling the recovery time. So all of the animals get the same injury, but they do recover. Normal rats recovered in about 3 weeks, and these other rats took almost 7 weeks to recover. So it is dramatically changing how their body is reacting to an injury. And this is, again, something that we see in humans. So obese individuals tend to take longer to recover from surgery or from injuries, and we think this is due to the sort of chronic immune system activation.
Mm-hmm. Great. And then, Johnny, you've done some research as well, now in your own lab, feeding rats a Western diet as well, so sort of more of an unhealthy diet. And maybe you can tell us about the effect on their baseline pain sensitivity. And you've done some really interesting work using sort of a new behavioral test with the rodents that measures a lot of what we do in research, what researchers do is to evoke pain with, something painful. But a lot of researchers are now trying to get at the question of, is an animal in pain to begin with if we don't have to poke them or hurt them? So maybe you could tell a little bit about the work that you've done and what you've found.
Thank you, Stephanie. So one of the things that we are looking at in my lab now, it's the effects of high-fat diet consumption during adolescence in terms of the neurodevelopment of the pain mechanisms, or the pain neurocircuitry, as we call it. So areas that are implicated with pain in the brain, like the amygdala, periaqueductal gray, thalamus, and sensory cortex, and also in the spinal cord, how these neurons wire once these animals are fed with these high-fat diets. And again, one of the main sources that we use in our diets are saturated fats, which I mentioned that are harder to metabolize in our system, and they have these pro-inflammatory properties. They can actually activate directly those same cytokine releases and also the inflammatory cells. So what we did in our model, once we fed the animals, we adapted the mechanical conflict avoidance system to evaluate the affective component of pain. So it's not that we are poking the animal and seeing or observing a response, but we are evaluating how the animals cope with a stressful situation and also a pain-like situation. So if I can, if you can imagine the device that we normally use to evaluate these behaviors, imagine basically two different boxes, box which is going to be lit with light, very bright light, and a dark box. So there's a bright box, a dark box, and the animal has to decide to cross to the dark side. Usually rats prefer to be in the dark. They hate being in the light.
Right.
So we use that aversive conditioning for the animals to train them to cross to the dark side. Now, once they are trained, what we do is that we put a probe which contains a lot of type of nails. They look like probes and nails that create a little bit of pain in the animal. So the animal now has a decision to make. They have to decide whether they're going to cross from the light to the dark and exposing themselves to this probe bed that can create pain. So that way we have found that animals that are fed with our high-fat diets that are really sensitive, they exhibit anxiety-like behaviors, but they are also really sensitive in terms of their hyperalgesia, in this case, mechanical hyperalgesia. And those are some of the findings that we've been putting together in the last few years.
Great. So the animals, they want to cross from the bright chamber where they don't want to be over to the dark where they feel safer. But once they're trained to do that, these little painful little sort of like needly type spikes kind of come out of the floor, and they have to decide whether to stay in this unhappy situation or withstand the pain. And so the animals fed the Western diet choose to endure the stress rather than to brave the pain. Is that right?
Yep. That's exactly what happens.
So, well, that's really profound. And then you said also that it's actually changing the way and these are not rats or animals that have been injured or had spinal cord injury or any sort of injection like that. These are just raised on the diet, right? And they're more prone to anxiety and pain sensitivity. And as you mentioned, even their brain wiring looks different just from the diet. So that seems pretty amazing. Wow. So let's bring it back to Dr. Sorge. We've shown in these animal models that that diet really does have a profound influence on not only how the animals seem to sense pain and how they act, how their brain is wired, the chemicals in their bodies and their spinal cord. It's a pretty profound effect. Rob, maybe you can tell us a little bit about the anti-inflammatory diet, the AID, and what can we do? So let's not have all doom and gloom. Is there anything we can do to protect ourselves with anti-inflammatory foods? So maybe talk a little bit about the work you did both in animals and in humans, looking at anti-inflammatory protective measures, and maybe we'll have some light at the end of the tunnel.
Sure, I think I could do that. So for our animals, we wanted to create a diet that did have a number of anti-inflammatory foods. And so we know that there are certain things that are good for us, and certainly Johnny has shown very good data showing that omega-3s are good. So we added some oils that were rich in omega-3s. We also added ginseng. We added curcumin, sulforaphane, which is the active ingredient in broccoli, resveratrol, which is in grapes. So if you're drinking wine, you're getting some resveratrol. And EGCG, which is basically like a green tea extract. So, of course, we've heard that green tea is good for you. So we added all of these.
We've heard of all those things in the media, that those are all anti-inflammatory good things, right? So you just basically kind of rounded those all up and added to the diet.
Yeah, so we wanted to look for things that, we knew from a scientific perspective had direct effects on this sort of inflammatory pathways. And so we took those and we tried to add them in sort of a human relative amount. So a lot of times when people are testing these supplements, they give them to animals in these massive amounts. Some of the resveratrol work is, something like 10 gallons of grapes a day. Well, we're probably not going to do that.
Right.
So we tried to do it. So our green tea extract is the equivalent to about 6 cups a day. The resveratrol is equivalent to about a cup of grapes a day. So it's something that you could do.
These are doable, right?
Yeah. So, you may not do it every day, but, it's certainly something that you could do with a supplement or something like that. And so we had our animals that were fed the sort of American diet, and at the time of injury, so the day that they got injured, we switched them to this anti-inflammatory diet. So wanting to sort of mimic, something happened, and this is one of the treatments. And what we found is that they recovered in about a third the amount of time that the other animals recovered in. So it dramatically sped up their recovery. It decreased their inflammation. Some of these animals were showing signs of sort of pre-diabetes, and it reversed that as well in as little as 2 weeks. And so this looked great. We were very encouraged with this, and so we thought, well, what could we do to translate this into people? And so we took a bunch of older adults with knee osteoarthritis pain, and we randomly assigned them to either eat what they're normally eating, put them on a calorie-reduced diet, so your typical sort of diet where you're just cutting calories, or what we were considering our anti-inflammatory diet, which is really just a low-carbohydrate diet. So it was similar to an Atkins or ketogenic diet, but really they just needed to cut down on the carbs. And they were on this diet for 12 weeks. We measured their functional pain and their sort of daily pain, and one of the big effects here is that when we ask them to do things that would cause pain in their knee, one of those things was repeatedly getting up and down from a chair. After the 12 weeks on this anti-inflammatory low-carb diet, these subjects showed almost no pain with that sort of functional test, which was very encouraging. The people that were on the low-fat or the calorie-reduced diet showed just as much pain after 12 weeks as they did at the beginning. And what was really cool is that both groups lost the same amount of weight. So it wasn't a difference due to the less pressure on the knee. This was actually due to the actual diet itself.
Right. So
That's
what's
cool.
inside, not just the sheer weight of the body.
Right. And I mean, the knee is definitely a weight-bearing joint, and if you lose weight, you're going to reduce some of that pressure. But in this case, both groups lost the same amount of weight, but only one group showed a change in this functional pain.
Great. All right. Well, thank you so much for describing that research, and both of you for describing your research. I'd like to come back and kind of speak with both of you and wrap it up and bring it back to patients and what people can do in their daily life. Like, how can we take these results that you both have found and others working in the field, and what's the message that how can we interpret this? And a lot of this work is still in animals and is moving into humans. Maybe you can kind of give us the outlook for, what is the outlook for the research moving into human clinical trials, and then what do you think people can do just in their daily lives? And maybe we'll start with you, Johnny.
Yeah. So in terms of translating the findings, and I think Rob and I have very similar results in terms of our rat models, I think balance is a key, It's really unlikely that you will have a healthy diet like 24/7 all the time. So I think that in terms of translating some of these findings, it's going to be really critical to establish a healthy diet, and trying to sustain a balance in terms of those components that we know that are healthier or anti-inflammatory versus the one that we already know that create this chaos in terms of inflammation. So I think balance is the key. Other findings that we've been putting together in terms of, these special diets that Dr. Sorge has and omega-3 fatty acids, I think that in terms of the new technologies that are rising, genomics and metabolomics, we are now able to understand specifically which are the components of these dietary interventions that are critical to sustain recovery or promote recovery and also to ameliorate pain. So with that in mind, one of the things that I think the field is moving forward to is finding those critical components and actually either prepare them, for different therapies or interventions with specific components of the diet. So I think, at least on my side, those are critical components to translate the findings. Balanced diet, and also finding out specifically which are the nutrients and specifically the molecules that are implicated in these responses.
Right, so if we can get down to the nitty-gritty, like what are the actual molecules working at the cellular level, then we can maybe skip the whole diet and go right to those targeted molecules.
Yeah, for the more critically ill and people that are, actually suffering from these dysesthesias and pain, I think that would be a really good intervention, because diets usually, in our rodent models, it's usually we see that fast, but in humans, diet effects usually take a little bit longer to take, effect.
Gotcha. And also I would point out it's harder to get humans to stick to a diet than it is to get rodents when you're feeding them. They don't have much choice. The humans are tougher, right? Okay. And Dr. Sorge, maybe you could wrap up for us. And again, just what do you see as future directions in terms of translating diet to a complementary pain treatment, and what people can do today?
Well, I'll just echo a lot of what Johnny said. It comes down to the sort of general lifestyle change. And if, enough people sort of get on board with this sort of, that our general diet just isn't good and that certain things do have to change, I think that will have a big impact. But again, just like you're saying, Stephanie, it's hard to get people to stick to a diet. And unless there is a direct reason. And so one of the things that we're hoping to start looking at is not just pain, but some of the peripheral things that diet can help as well. Things like cardiovascular disease and the cholesterol and all of those things that can also be improved with diet. So as much as, in general, we want a pill that's going to just reduce our pain, diet has all of these other benefits as well. And so not only can it reduce your pain and inflammation, but decrease your risk for a whole host of other things. And so I think that, this is going to progress in two basic streams where, there's going to be people that are, really trying to get these lifestyle changes accepted, and there's going to be people who are looking at, the specific molecular substrates of the diet and how we can block that. Of course, if people could eat whatever they want and block the bad part of it, that would be fantastic. But in the meantime, a lifestyle change is probably the best thing.
Right. I totally agree with that. Yep.
Great. All right. Well, Robert Sorge from the University of Alabama and Johnny Figueroa from Loma Linda University, I want to thank you both so much for being my guests today at Relief.News talking about diet and inflammation and pain. Thank you both.
Thank you very much.
Thank you, Stephanie, for having us.